my name is Courtney and today I'll be presenting my portfolio on basic care of domestic dogs. So today we will just doing a portfolio on one of our dogs that we have here today. Her name is Roxy. She is a 2-year-old Labradoodle. She is chocolate in colour. So basically Roxy has come in today because she is going in for a spay later on this afternoon. So what we're going to do with her basically is just give her some a little bit of care beforehand. So we're just going to be exercising her in the yard, stretching out her legs before she goes into surgery. Just doing an overall health check on her. Just checking her weight and all those sorts of basic things. So basically I'm starting earlier on with a consultation with one of the vets and her owners. So at this point in time she's not showing any signs of any health issues or anything. She has had a full blood workout done. Everything has come back clear. She's up to date with all her vaccinations, so she's all clear to go ahead and have her spay done today. Basically, some identifying features about Roxy is that she does have a medium to large build. She is quite shaggy with her hair. She is chocolate in colour. Now, some identifying features that we have noticed on her is that around her mouth she's starting to get a little bit of a grey patch. Her eyes are quite brown. They do have a fair bit of white behind them. Her ears are quite long and droopy. She does have a very easy temperament. She is quite easy to handle. She's very playful and will interact with me quite easily. Basically what we're going to do today is after we've walked her, we're going to bring her back in and she's going to get prepared for surgery. Once that surgery is done, a couple of hours after, we will start to see how she is coming along, and then we will make the decision whether to feed her or not. Basically we're just going to feed her a small amount of dry food if need be. That's just to stop any sort of moisture from irritating her stomach or anything like that. So later on we will be showing you a video of just preparing that food and me giving that food to her if she does take it. Now she does enjoy being on the lead, so we are going to now go and grab her out of her kennel. She's just placed in a long run that is behind me at the moment. So once we've got her in, we will take her outside and you'll just see me basically just give her a quick walk around, give her a sniff around, seeing if she needs to urinate at all, allowing her to stretch out her legs. So today Roxy is currently located in one of the runs here. So these runs basically are for our medium to larger dogs. This is where they are held before and after surgery. So basically what we'll be doing today is once we have done here, we'll be retrieving her, popping her on a lead, which will be a slip lead. That'll just go around her neck and she'll be walked outside. Hi, so basically what we're going to do now is we're going to pop this slip lead around Roxy's neck. We're going to restrain her and we're going to walk her outside. Basically what we've already done is we've gone out the back, we've just cased the area, making sure there's nothing out there that can be a hazard to either her or myself. We've locked the back gates just to ensure that if she does get loose for whatever reason, that she can't go anywhere. So basically right now I'm just going to restrain her by popping this around her neck and taking her outside. So Roxy's run basically that she's been placed in has just been placed in there with a towel for bedding for her. Now because she's going into surgery, we want to make sure that her stomach and her bladder is just all clear of any sort of food or urine or anything like that. So in her kennel, all she has is just a towel for her to have a sleep on, have a rest on before her surgery with no food or water. When she's brought back from surgery, we might possibly put a bowl in there, just depending on how she's waking up. Obviously after the anaesthetic, she can have quite a dry throat, so that bowl of water can help. Later on, once she's awake completely, we will go through a few dietary requirements of what it is that we need to feed her. Just because obviously she is waking up, we want to make sure that she's completely alert before we feed her anything, just to avoid any choking or anything like that. So basically now what we've done is we're at the back of the clinic in this wide open grass area, so we're just going to take Roxy out now, basically, and let her have a walk. I'm just going to allow her to stretch out her legs and to go to the bathroom if need be. So this is a daily treatment that we try to do with every dog that comes into hospital that is coming out of recovery and is able to kind of get up and go home that day. Basically, it's just giving them just a little bit of a chance just to be outside one last time just before they start to go through their recovery process.
Okay, Courtney, so while you were assisting with Roxy's consultation with the vet before she's admitted for surgery today, Can you go through with me the signs of good or poor health that we noted during the consultation?
Yeah, so basically we have Roxy in today. She's a 2-year-old Labradoodle. She's in for her stay today. So basically, during a consultation, so just before we take her in and get her admitted, we just need to go through a few little things, just find out about her overall health. So basically, Roxy being a 2-year-old lab, we have a look at a few things. So we can look at her coat, see that it's nice and shiny. It's not showing any signs of any dryness or anything. Because she is a dog that has longer hair, we do need to just take into consideration her skin under there. So we just had a look at her skin. Her skin appears to be in good health. She has no signs of any dandruff or any dermatitis or anything like that. For that 2-year-old Labrador, she is sitting at that 21 to 23 kilo range at the moment, which is really, really good for her. So we're about a 22.5. But just basically because she is got that Labrador in her, they are prone to joint pain. So we do have a look at her gait. Her gait seems to be normal. She's got no lameness, no pain, nothing of that at the moment. With her teeth, we always just have a look over the teeth. Obviously, at 2 years old, you're eating a lot more, chewing a lot of things. At this point in time, her teeth are looking nice and white, nice and strong. There's no tar or any bad breath, which obviously indicates sign of infections or anything like that. So that all seems to be amazing. Pretty much, we just had to ask the owner when was the last time she'd eaten, which was last night, just because we want to make sure that she's nice and clear for surgery. Upon asking those ground questions, we also just want to make sure that, she's just eating and drinking as per normal, just to make sure that she's treating well. Basically, eating, drinking normal, defecating and urinating quite frequently enough for us not to be too concerned about that. So overall, for her age of 2 years old, she seems to be in pretty good health. Okay, so Roxy has had her surgery and she's in recovery and she's recovering quite well. Basically, the vets have just advised me just to provide her with a small amount of water just to keep up her fluids and a small amount of dry food. We can't guarantee that she's going to eat it, but she does seem to be waking up a little bit more. So in that time, I'm going to prepare her some food. Like we said, something nice and dry with just a little bit of moisture. So behind me is her food and the bowls. We're just going to get all that ready now. Now, this is the dry food that we are going to measure the food of. Alright, so I'm just going to use a measuring cup. Cool, we are just going to be using half a cup of food for now. And just a small amount of water. Alright, as you can see behind me is Roxy, so she has woken up from her surgery. You can see that she's quite in good spirits. She is very lively and very awake at the moment. Her gait seems to be alright, that meaning basically that she's up and she's moving around quite comfortably. We are just going to jump into her kennel for a second and pop her some food and water, and she has a response to that. As you can see, she is panting, so she would be quite thirsty at this point in time, especially after being on the anaesthetic for so long. Alright, so basically now what we're going to do is we're going to monitor her for the next few hours just to see how she takes that. She will be sent home with a course of antibiotics. Her owners will be instructed on how to use that, and those antibiotics will also be on her record as to what she's taking, how much, and how many times a day.